All right, everyone. We are going to do a recap over Chapter 5 Skin Analysis. We already covered a lot of these, but I'm going to go ahead and just do a recap on we already covered in class and finish up with the last couple pages that we did not touch base on in class. Now, I know you guys said you were more visual, so you wanted to kind of see. So I'm going to try doing it this way and let me know if this works better for you to take notes so you can see kind of what I'm going off of as I'm speaking. So, what is skin analysis? So, before performing services or selecting products, an individual skin type and conditions must be analyzed correctly to determine the appropriate treatment and products that you will be using on the individual. A thorough analysis and client consultation is important to determine the cause of any skin conditions and any contraindications. Now, remember, contraindications are any conditions that your client will have that will prevent you from performing the treatment on that client. Skin types. So, identifying the four genetic skin types. Skin type is a classification that describes a person's genetic skin attributes. Skin type is determined by genetics and ethnicity, but like everything else, skin can change over time. Generally, skin becomes drier over time because our cellular metabolism and oil lipid production slows down as we age. Skin type is based primarily on how much oil is produced in the follicles from the sebaceous glands and on the amount of lipids found between the cells. Evaluating the pores in the T zone is the first step in determining what the skin type of your client is. When we perform skin analysis, we are using our visual abilities to note properties in the skin, such as the pore size or irregularities in the skin. Remember, we use palpation to examine the skin through touch, manipulating it to determine the conditions, such as any oiliness and elasticity of the skin. We use consultation to determine lifestyle or dietary issues that are impacting our client's skin. So we have normal combination, oily and dry. Your normal skin type is going to be classified with a balance of oil. It's going to be a balanced hydration. The follicle size is going to be small. The appearance is going to be uniform, is going to be luminous. There's going to be none or very rare blemishes. It's going to feel soft. It's going to have a smooth texture and good elasticity. Your treatment, you want to maintain and prevent and prevention treatment. Remember, a treatment for maintenance and prevention. Basically, you want to cleanse, exfoliate, nourish, and protect that skin. And remember, we also said as the client ages, you want to start adding some additional things to help maintain that skin for your client. Why? Because body systems functioning holistically for balance, most common in those in their 20s and 30s. Next, we have combination. So, combination skin type is going to have a moderate to high oil. The hydration is going to be good to dehydrated in some areas, of course. Your follicle size, you're going to see larger on the T zone and then smaller or almost not visible on your cheeks and the side of the face. The appearance can have a buildup of dead skin and oil in the pores around the nose, but might be dry or flakiness on the outside of the T zone. You will see some blemishes and comedones. It's going to feel oilier in the T zone than on the side of the face. You want to make sure you cleanse and regular exfoliation for this client. Remember to use water based products and avoid any harsh product and rough exfoliation. So, we want to do some gentle exfoliating. And there's an overproduction of oil in the T zone. That's why these clients have that combination. In that T zone, they'll have an overproduction of oil, and in the other area, they will not. And they have normal oil production in the other areas, or dehydrated skin on the sides of the face. Our next one is going to be oily skin. So, oily skin is going to have moderate to high oil production. The hydration is going to be good to dehydrated. Your follicle size is going to be moderate to large, and the appearance is going to be shiny. You're going to see a lot of those comedones. Blemishes may be present. The feel of the skin is going to be thick and firm, and it'll be uneven due to that congestion. So, as you're running your fingers through it, you'll be able to feel that congestion on your client's skin. You want to do regular cleansing and exfoliation and hydrating with water based products. Treatments to balance oil production. So, you want to use some products that will help with that balancing of the oil production or the excess oil production in the skin. So these clients have the skin because they overproduce oil a lot of times due to genetics, to hormonal changes, stress, or environmental factors, such as skincare products or makeup that are comedogenic. And remember, we said products or makeup that are comedogenic are those that can cause those comedones on the skin. Overexfoliation can create oilier skin as the sebaceous glands work to increase surface dryness. So just be careful with the exfoliation. You can go in with a little, I would say, rougher exfoliant, but you want to make sure you don't over exfoliate or your client is not exfoliating like every single day, because that's not going to make it better. And then we have our dry skin type. Now, our dry skin, the oil production is going to be very minimal. There's going to be minimal production of hydration. The follicle size is going to be almost invisible. It's going to be very hard to see, very, very fine pores. The appearance of the skin is going to be dull. It's going to lack luminosity. You'll see like flaking and blotchy. When you touch it, it'll feel rough, thin, or tight. Now, for our dry skin, we want to make sure that we use oil based products to provide protection of the acid mantle and increase the barrier function. Remember, clients who have dry skin tend to have more water loss caused by the evaporation on the skin surface. So, the TEWL, we want to make sure we try to prevent that as much as possible, give the client as much protection. Treatments to provide nourishment and protection for the skin. Correct. And this is due to an underproduction of oil. It can be due to genetics, environmental factors, or hormones as well. That's why a lot of our clients have that skin type. So next we have the Fitzpatrick scale. We did talk about this. It's a development. It was developed by Dr. Thomas Fitzpatrick, and it is used to measure the skin type's ability to tolerate those ultraviolet exposure. Many skin treatment protocols are based on the client's skin type on the Fitzpatrick scale. Now, this is just kind of like a guideline, remember, because it's not always exact. Every client is different. But your lighter skin types are generally more sensitive. Individuals with darker skin will have larger melanin deposits in the stratum corneum, which gives them more protection from the sun. But darker skin types can, remember, hyperpigmentation. They can be more prone to that hypopigmentation, and keloid scarring may occur during aggressive treatment. So we want to be very careful with that. So I just want to show you a little bit here. On the book, I don't believe there was pictures, but I found this graph and I really liked it because it had some pictures that you could see. Yeah, I didn't have pictures. It just had the color. So you can see your type 1, they're going to be pale to very fair skin, red or blonde hair, light color eyes, and they may have freckles. Their skin exposure, they will always burn, never tan. They have a high risk of skin cancer and vascular damage. Your type 2, fair skin, light eyes, light hair, burns easily, rarely tans, high risk of skin cancer and vascular damage. Your type 3, fair skin, medium to dark hair, eye color, it may vary. Sometimes burns, tans gradually. The risk of hyper or hypopigmentation is there, and moderate risk of skin cancer and vascular damage. Your type 4, light brown to tan skin, dark hair and eyes, rarely burns but tans easily. There's a high risk of hypopigmentation. It scars easily and moderate risk of vascular damage. Your type 5, dark skin, dark eyes, dark hair, skin darkens but never burns, high risk of hypopigmentation, high risk of scarring, moderate risk of vascular damage, and low risk of aging and skin damage from sun exposure. Excuse me. And then your last one, very dark skin, dark eyes, dark hair. It tans easily, but it never burns. Very high risk of hypopigmentation, high risk of scarring, moderate risk of vascular damage, low risk of aging and skin damage from sun exposure. And remember, there are also other measurements that they use. I believe there was two other ones that were mentioned in the book. The Glauca scale and the Rubin scale, but this is usually the most common one. So you want to kind of go off of this one. Okay. So sensitive skin is easily irritated by products or by exposure to heat or sun. Telangiectasis is visible, broken, or distant extrinsic causes. May be noticeable on sensitive skin. Fragile or thin skin can also be the result of age or medications. Sensitive or sensitized skin can be difficult to treat because of its low tolerance to products and stimulation. For example, excessive rubbing, heat, exfoliation, or extractions can cause damage and increase redness. It needs to be treated gently with non irritating calming products and treatments. The primary treatment goal for sensitive skins are to soothe, calm, and protect. So you're definitely not going to want to do any of that steaming on the sensitive skin. You don't want to irritate it more. You want to do some gentle rubbing. Don't over rub the skin either. Your exfoliation, make sure it's a very light exfoliant, something that the skin can tolerate. And your client's skin will always talk to you as you're performing the service. So make sure you're paying attention to what it's saying. Our body talks to us. Same way when you're doing a service on a client, that skin's going to be talking to you. If it starts getting red, if it starts getting irritated, you're going to see it. So you need to make sure you stop. You need to make sure you, put a mask on, something to calm it down. So you'll definitely be able to see what's going on with the skin, and you just need to learn to kind of read it and determine what it needs at that moment. And like I said, don't be afraid to ask your clients. They know if they have any conditions or anything, they know what makes it better and what makes it worse. So ask them, is there anything? And you can leave it open to say, is there anything I should be aware of that irritates your skin more or that causes it to be more sensitive? And they will tell you. All right. So treating options for the neck and décolleté. The skin on the neck and décolleté is not the same as the skin on the face. The neck and the décolleté have fewer sebaceous glands than the face, so they will tend to show aging more quickly. Photo damage, broken capillaries, fine lines, and wrinkles develop just as much on the neck and chest as on the face. I'm gonna pause there for a minute. You know, a lot of times you see celebrities